Welcome to Posters to Practice, the podcast, a new series brought to you by the editors at the Dermatology Digest and the Journal of Dermatology for nurse practitioners and physician assistants. Listen and learn as experts review posters from Maui Derm Hawaii 2026. Take it away, Dr. Chevatia.
Hi there, my name is Dr. Raj Chevatia. I'm an associate professor at the Rosalind Franklin University of Medicine and Science, Chicago Medical School, and founder and director of the Center for Medical Dermatology and Immunology Research in Chicago, Illinois. It was my pleasure to present the Phase 2b findings from the Resolve AD study here at Maui Derm 2026. Resolve AD was a study that was designed to take a look at the effect of rezpegaldesleukin, or REZPEG for short, a novel medication that activates the IL-2 receptor and causes expansion of regulatory T cells. And the idea here was, if you expand regulatory T cells, can you drive resolution of inflammation in an inflammatory disease like atopic dermatitis? And so what we found was that there was indeed improvement in the signs and symptoms that we'd look at in atopic dermatitis, EASI scores, EASI 75, EASI 90, and IGA of 0 or 1. We saw improvement of itch in terms of a 4-point improvement of itch, but very interestingly, for the patients that had asthma, there was an improvement in their asthma scores as well, particularly the ACQ-5 score. And so what this data seems to suggest is that this novel way to go about treatment, where you're not specifically going after a single cytokine, but rather expanding the cells that might resolve the inflammatory process, could be a fruitful mechanism to not only treat a disease like atopic dermatitis, but a chronic disease like asthma as well.
Now, Dr. Harper shares some compelling long-term data on the triple combination acne gel.
Hi, I'm Dr. Julie Harper, board-certified dermatologist in Birmingham, Alabama. And I'm at Maui Derm and happy to present a poster today on more long-term use of the new fixed-dose triple product for acne. So this is, of course, that product that is a combination of clindamycin, adapalene, and benzoyl peroxide. By now, we're all familiar with the Phase 3 12-week studies and the efficacy and the speed of onset that we saw in those. But we look at 12 weeks there and we say that's the primary endpoint, but it's not the primary endpoint for our patients. So a question arises then, what happens past 12 weeks when you stay on this single agent but fixed dose triple product? 2 studies have been performed. Each of them were open label, and each of them enrolled 25 patients. So a total of 50 patients are included in these 2 studies. Out of those 50 patients, 45 of them completed one of these 2 studies. The 5 of the patients who dropped out of those 5, 3 of them did drop out due to a potential adverse event from the study drug. 2 of those thought to be perhaps having an allergy to benzoyl peroxide, and the last one having an irritant contact dermatitis. So let's focus first on efficacy. So we're going to talk about those traditional endpoints that we see in our acne studies. We're going to look at IGA success rate, and people in the study, again, started out mostly moderate. About 88% of the people in the study were moderate, and the rest had severe. So this was a pretty significant amount of acne. Now, we may remember that in the Phase 3 trials at week 12, we had 50% of people clear or almost clear. And in this study, at 12 weeks, we also had 50% of people clear or almost clear. But again, we want to know what happens, not just at week 12, but at week 24. And interestingly, and probably not surprisingly, the longer people stayed on the drug, the better they did. So by the time we got to week 12, 67% of patients were clear or almost clear. Now, we're also going to look at lesion count reductions. What happened to inflammatory lesions? What happened to comedones? Again, in the clinical trials, the Phase 3 trials, we had excellent results with about 70% reduction at week 12 and 50% reduction at week 4. But if you pull this out to week 24, even better, we're getting 88% reduction of inflammatory lesions and 68% reduction in comedones. Not only were we looking at the most traditional efficacy endpoints that we would look at in Phase 3 trials, but we also want to know some things that are really important to our patients. What happened, for example, to acne scarring? What happened to post-inflammatory hyperpigmentation and to post-inflammatory erythema? And all of those things were also measured in this study. Now, this was an open label study. Again, we mentioned that. But at the end of the study, at week 24, so a 6-month study, acne scarring had decreased by 33% from baseline. Post-inflammatory erythema had decreased by 77%, and post-inflammatory hyperpigmentation had decreased by 71%. We always want to be fair and balanced in any study, so if we talk about efficacy, we have to match that discussion with the discussion of adverse events. But importantly, more than 70% of people in the study really had no adverse events related to this drug at all. And even in the group that did, none of them were considered severe, and less than 7% of them were moderate. So most of them were mild. Again, we did have the 3 individuals who dropped out of the study due to benzoyl peroxide allergy or irritant contact dermatitis. So this is a triple product that contains an antibiotic, and most of us are really interested. What happens when you use a topical antibiotic for 6 months? Do we have to worry about the development of resistance to the C. acnes that are being treated? Now, this also contains benzoyl peroxide, which should protect us potentially from that. But in this study, they actually looked at the isolates of C. acnes at baseline, and they get again at 24 weeks to see if there was a change in resistance, to see if the C. acnes at the beginning of the study, if it was susceptible then, was it still susceptible at the end of the study? And the answer is yes. Now, at the beginning of the study, 5 individuals, or 11% of people out of this study, had C. acnes isolates that were already resistant to clindamycin. And at the end of 24 weeks, only those same individuals, those same 5 individuals were still resistant, indicating that that number did not change. For the rest of the individuals in the study, there was not a change in susceptibility. They were either still susceptible to clindamycin or the C. acnes did not grow at all. Lastly, even the individuals who were resistant to clindamycin at the beginning of the study, those 5 individuals, when you go back and look to see if those 5 patients had improvement with this triple fixed dose product, the answer is yes.
Dr. Hawks reviews phase 3 data, a potential new therapy for hidradenitis suppurativa.
Hi, I'm Dr. Jason Hawks. I'm co-owner, chief scientific officer, investigator at the Oregon Medical Research Center in Portland, Oregon. Here at Maui Derm 2026, in the late breaker session, I led this with Dr. Linda Steingold. And one of the exciting posters we talked about was povorcitinib, JAK1 inhibitor. The phase 3 studies of STOP-HS1, STOP-HS2. This is an exciting new novel mechanism of action in HS because we know HS, unlike some of these other conditions, psoriasis, atopic dermatitis, there's a lot more immunology going on. The advantage of the JAK inhibitors, they can broaden out, hit some of these multiple pathways, and we're seeing better improvement. Particularly in these studies, povorcitinib actually helped these patients meet all the primary endpoints for HiSCR 50. We saw the majority of these patients doing very well, having improvement. One of the key findings is that we were able to see improvement in dropping their draining tunnels. These are those tunnels under the skin that collect the bacteria and the inflammation, have coming out both sides. We're able to watch these in the clinical trials, probably one of the more advanced features of HS. As we see these draining tunnels improve, we know that we're knocking down the inflammation. And of course, these patients have improved quality of life. They're not getting these painful draining tunnels that happen in their skin, along with the inflammatory components. So this is an exciting way to push the envelope on what we're seeing for treatment strategies in HS. So exciting to see where this is going to land in the pipeline. Pay attention. Thanks.
Dr. Baldwin discusses a new study depicting the sebum-reducing effects of clascoterone.
Hello, my name is Hillary Baldwin, and I run the Acne Treatment and Research Center in Brooklyn, New York. And I'm here at Maui Derm to talk about a poster that looks at the reduction of sebum utilizing the medication clascoterone. Now, you might think, we always knew that clascoterone reduced sebum, and we did, but we only knew that in vitro. So they went back and finally did an in vivo study taking a look at sebum reduction over a 52-week period of time in 40 patients with mild to moderate acne. The patients applied the clascoterone twice a day, as is on the package insert, for those 52-week period of time. And this was an open label, single center study. The primary endpoint of the study was improvement in acne lesions, looking at the IGA success being clear or near clear, as well as looking at reduction of what's referred to as casual sebum, which is looking at the sebum which is left on the face 2 to 4 hours after cleansing of the skin with no application of any creamy substance in between. So these patients were evaluated at baseline and again several points along the way until that 52-week at the end of the study. They looked at IgA, they looked at inflammatory and non-inflammatory lesion count reduction, as well as reduction of sebum, but also some clinical findings of oiliness of the skin, as well as facial shine and even pore size. And what they found over the 52-week period of time with a steady decline in all of those parameters was a 79% reduction in oily skin, a 78% reduction in facial shine, a 49% reduction in pore size, 55% reduction in IgA, and lesion count reductions in the 70s and the 50s for inflammatory and non-inflammatory lesion count. So yes, indeed, this medication does decrease sebum production in humans in a clinical trial. And along with it, the parameters that you would expect, like the lesion count reduction, global assessment, as well as the clinical findings that you would expect from somebody whose sebum has been reduced, i.e. decrease in facial shine, oiliness of the skin, and pore size.
Dr. Hawks also reviews new data on the use of risankizumab in kids with psoriasis.
This Optimize 1 study is really critical for a number of reasons. If you look at the number of available systemic options and biologics for patients who are adult with plaque psoriasis, we see a number of options. We have about 12 biologic options, but that number shrinks to less than 50% in the pediatric population. And we only have one therapy in the IL-23 class. We have IL-23 with ustekinumab, and we have guselkumab with IL-23. But this is critical because in the pediatric population, we want to see fewer injections. And to have the best efficacy in the class of medications that we have with fewer injections, we want to expand the number of treatments here. So this study looking at risankizumab looked at patients, pediatric patients, where we were able to follow them out to 52 weeks. And not surprisingly, we see its excellent safety profile, no major concerns, no major infections, well-tolerated injection. But at 52 weeks, we're seeing almost 2/3 of patients have complete clearance. So this is really going to expand our treatment options. It's an appeal to the pediatric patient, certainly an appeal to the parents. And as we expand the options in pediatric psoriasis, we're going to keep pushing the limit on clearance and improvement, and possibly even help for some of the comorbidities like those pediatric patients who get psoriatic arthritis. Thanks.
In other psoriasis news, there's been lots of buzz about a potential first-in-class targeted oral peptide for psoriasis that blocks interleukin-23. Dr. Steingold, take it away.
Hello, I'm Linda Steingold. I'm from Henry Ford Health System in Detroit, Michigan, and I'm here at Maui Derm. I was really excited to present a poster on icotrokinra. I talked about the iconic LEAD trial, and we had a readout over 52 weeks. What's interesting here is I discussed a portion of that study where we looked at either continuing on the medication or withdrawing from the medication and looked to see how well those patients did over time. And what we found was those patients who continued on drug over the course of 52 weeks continued to maintain that very high efficacy. Those patients who went off drug, they lost efficacy, but fairly slowly. Between 2 to 3 months, they lost either their EASI 90 or their EASI 75. And what's really exciting is we looked at the adolescent data. That data was quite interesting in that the adolescents did so well. They got very high levels of efficacy, and it happened fast. When you look at the curves, they're very steep. We have a rapid onset of action, and they maintain that efficacy really nicely over the course of the 52 weeks, really at a level equivalent to a biologic drug. When we look at the side effect profile, there's nothing new there. No safety signals were identified. The drug's well tolerated. So it's an exciting time in the oral therapy landscape for our patients with moderate to severe psoriasis.
Thanks for tuning in to the Posters to Practice podcast. If you enjoyed this episode, be sure to subscribe, share it with a colleague, and stay tuned for more episodes. See you next time.